Hello, everyone. My name is Linda Ercoli, and I'm a clinical psychologist in the Division of Geriatric Psychiatry at UCLA. Just to give you a little background, and today I'm going to be talking about driving cessation in dementia, what caregivers need to know. Now, this is a very important topic, and I know that for some individuals it's also a sensitive topic. So I hope that everyone learns something today about this and can take away some pearls of knowledge, just in case you are either personally or know someone who's in similar situations of having to work with a loved one who has dementia, who may be unsafe and continues to drive. If you would like, you are free to tweet in questions using hashtag UCLAMDChat. So I'm going to cover a few topics within this area today. One is some background of why it's dangerous to drive with dementia, and then talk about some interventions or actions that caregivers or relatives can take if they have a loved one who continues to drive, who they're concerned about. So let's talk first about dementia drivers and risk. One fact is that people with dementia are at higher risk for auto accidents. Why is this? One is because due to the process or the diseases that are associated with dementia, there can be cognitive and physical changes that make someone or render someone unsafe to drive a car. And what really happens with many people is, although some individuals with dementia do feel like it's time for them to stop, themselves to stop, and may limit or even decide they no longer wish to drive, they feel unsafe, some individuals continue to drive and are driving in an unsafe manner. People that continue to drive often have lost the awareness of their own neurological or thinking problems associated with dementia. In fact, that's part of dementing disorders. People lose self-awareness. They might lack the ability or lose the ability to really determine when they should stop driving. And in fact, sometimes people with dementia who've lost that ability to really realize that they're not safe anymore is they might make excuses or blame other people for driving problems. So just because I got lost, for example, doesn't mean I can't drive, and so on. But actually, driving with dementia is a public safety problem. And it can be a serious problem because we know that as adults get older, and because dementia is a disease that most of the time is associated with age, then the risk of becoming demented is increased with age. And therefore, because most people who are over 65 do drive, you could see that the number of people driving with dementia is likely to increase. It's estimated that nationwide, about 30% of drivers with any type of dementia are still driving. And so what is meant by dementia in this case would be severe cognitive problems that interfere with your daily life or daily functioning. So things like Alzheimer's disease, Lewy body dementia, vascular dementia, frontal temporal dementia. These are serious disorders. I want to make a clarification that we're not talking about somebody who has age-related mild forgetfulness and who maybe is not functioning as efficiently as they were, let's say, 20 years ago. This is not what we're talking about. I'm talking about people who have such a bad memory or cognitive problem that it interferes with their daily life. And one of these things would be driving. Also, the statistics show that people with dementia have a higher crash risk. And in fact, some statistics show that even people with early or mild Alzheimer's disease, they have a higher number of accidents than drivers that are of the same age that don't have Alzheimer's disease. All right, and in fact, the accidents can be very similar in frequency to teenagers, which have a very high risk of accidents when driving. So you could see that there's 19 to about 27 crashes per million miles traveled is the statistic. And again, that's similar to teenagers. Also, caregivers report. If you survey caregivers and tally up what they're saying about their loved ones who have dementia, caregivers reports show that people with dementia have maybe up to 8 times greater risk of crashes. And again, this is compared to people of the same age who do not have dementia. There was just one study done that I know of to date that actually looked at brains of people who died in crashes. And these are of older drivers. And this was done in Europe. And about 33% of those brains showed brain abnormalities or pathology that was indicative of having Alzheimer's disease. And in most of those cases, the killed driver was at fault for the accidents. Now, driving with dementia then can pose a safety risk to other people, but I want to emphasize too that it's a safety risk to the driver. That people with dementia, when they drive, at a higher risk for danger, and that includes getting injured and death due to getting lost while driving. So people can end up in strange locations. They can also end up being exposed to the elements. If they, for example, if they get lost when there's extreme heat or extreme cold. And they also can be preyed upon by others when they're lost. So this is a safety risk for everyone, the public, and that includes the individual with dementia who is driving. So knowing this, what can people do and what can caregivers do who are in this situation where they have a loved one that they're worried about who continues to drive? And this is something that I hear a lot about. I run caregiver support groups for individuals who are caregivers of people with dementia. And one of the challenges they face is that they have a loved one who continues to drive with dementia, and they don't know how to help them stop driving. They're very worried about an accident. They're worried about somebody getting killed or hurt, and yet they feel that they can't influence the person to stop driving. So what can caregivers do who find themselves in this position? Well, the very first thing is to acknowledge that it's really hard for somebody to turn over the keys and stop driving. And that's for any reason, right? And it's not just people with dementia, I want to emphasize, that may be required to stop driving by the DMV. It can be other groups of people too, people who've had seizures or strokes or who have visual impairment. But it's hard for anyone to stop driving. And one of the reasons is that it's a great loss of autonomy and independence. So a lot is at stake. Our society right now has the greatest number and highest proportion of individual older adults ever. So these older adults are highly mobile. They need cars or they need good transportation to get them around, to meet their needs, etc. So turning in the keys or stopping driving can greatly influence their ability to go to the store, to go to doctor's appointments, and also can affect people socially, like meeting with friends, etc. And it's been shown that sometimes when people stop driving, they become socially withdrawn and depressed. So this is something that caregivers need to know, and everyone needs to know, that it's difficult to turn over the keys, but there are ways to reduce and limit driving to help offset and try to prevent some of these losses of autonomy. Now, family members often realize that somebody is unsafe, and this creates a lot of worry in the caregiver or the family member. And families can be very influential to getting someone to drive, to stop driving or at least cut back their driving. But they might be hesitant to intervene. Now, why is that? Well, first of all, people are afraid that if they bring up the topic, they're going to damage their relationship with their loved one. And this can happen. People get into arguments over this topic. People's feelings get hurt. People get defensive. And so a lot of family members feel like, I just can't bring this up. Another reason is that families are conflicted about this topic, because if somebody does have to turn in their keys or stop driving, then more burden is placed on the family to provide transportation for that individual. And more burden, more expense, more time, and people have very busy lives, and it's not so easy to do this. So that's another reason why family members might be hesitant to intervene. And finally, people sometimes just don't know how to intervene. They don't get a lot of help in this area, not a lot of education on this. And so they may want to, but they don't quite know how to approach their loved one. So one of the major factors for somebody who needs to talk to a loved one about driving is education. To begin to understand what happens in dementia, what are the cognitive and physical changes, so they can get an appreciation for the risks of driving with dementia. And the other is to be sensitive to the fact that people are very concerned about losing their independence and autonomy and might become depressed and withdrawn. But one question that it comes up is, given this information, all right, how do I know, or how does a caregiver know if someone is unsafe? Because some people aren't sure. And so I'm going to show you a few warning signs that are associated with dangerous driving. And sometimes a single question might help address this. And it's simply, would you let your child ride with your loved one in a car by themselves? And if the answer to that question is no, then that person needs to ask themselves why. Why don't I feel comfortable with that? And that will help people really determine if they have concerns or if their loved one is not a safe driver. But really, let's look more at signs of unsafe driving. And this is unsafe driving, you could say, in anyone, but today we're talking about dementia, so these are things that would apply. So 3 very important signs in red that really indicate somebody should stop driving immediately. The first is confusing the gas and the brake. And this is very serious. We've heard of accidents, tragic accidents that have happened when the gas and the brake are confused. The second is somebody needing a co-pilot. People should be able to drive by themselves and navigate without having problems determining if a person's in a crosswalk, or without problems judging if they should make a turn or not. And so having a co-pilot in the car to help somebody make those decisions is a sign of dangerousness, or let's just say higher risk. And then stopping in traffic for no apparent reason is another sign of very high risk. But there are other signs that you may have noticed. You might have seen it on the road in your travels, or you may have even seen it in a loved one. So riding the brake, not noticing road signs, so like rolling through stop signs or signs that say no right turn and someone makes a right turn, near misses, accidents, and having scrapes and dents appear on the car, so even small accidents. Hitting the curb. How do other drivers react? So are there a lot of people honking the horns at a driver? And then people might feel like they've lost confidence in driving. And I think this is very important, in that if somebody feels like they can't drive anymore, they don't want to drive anymore, then they shouldn't be pushed to continue driving. Now, all of us might do some of these activities now and then. For example, I'm sure we've all had someone honk the horn at us. We've all hit the curb now and then when we're trying to park or when we're making a turn that's too close. But this is not just about having a bad day. This is about driving patterns that are evident in a person and not just once in a while things. So one of the first things a caregiver can do is actually observe someone's driving. Have the person drive you somewhere. Go with the person. So go on a ride along and ride in different areas or different situations. And then take notes or take a tally on how the person is driving in certain situations. So how are they driving at intersections? Are they showing good judgment? So intersections and turns are some of the most high-risk situations for someone who is driving with dementia. So that might mean making a left turn into oncoming traffic and not yielding the right-of-way, for example, or not paying attention to who's in the crosswalk when making a turn. Does a person stay in lane? How do they behave with activity around them on the road? So how do they behave in their driving around cyclists and pedestrians? How are people managing at crosswalks? So are people checking their blind spots? And how are they managing merging onto the freeway? So these are things that you can do and take a note of if someone is having a problem in these kinds of circumstances. So you would want to go on a ride along actually a couple of few times. Again, this is not about having one bad day of driving. This is about a pattern of driving. And some people may not have problems driving in familiar areas, and other people might. So you'd want to really get a good sense of someone's driving ability across different situations. The next step is to start to have conversations about driving, short conversations. So simply strike up a conversation about how did it go on your way to the store today, and find out how your loved one actually feels about how the drive went. Did they have any nervousness? Did they have a near miss? Things like that, because what the person tells you is important. And mainly, how do they feel about driving? Did they feel confident? Do they feel nervous? And then over time, one can actually strike up longer and more serious conversations. You could say more heartfelt conversations about driving. So it might be that you have to actually address someone. You know, there'll come a time when you'll not be able to drive safely. Let's talk about what to do to be prepared for that time. So the idea is to start having this conversation early rather than later, which emphasizes that talking about driving and thinking about when it's time to stop driving is a process, right? This takes time. And it's important to be sensitive to how the other person feels. So having gentle conversations and then working your way up to more serious conversations is what to do. Share your concerns with your loved one. So be frank. I'm worried, for example, about how you merged onto the freeway or that you didn't see that person in the crosswalk. These are important. And it's also important to have others share their concerns, too. I know of a case in one of the caregiver groups where a patient would call up her friends and say, how's my driving? My driving's okay. And actually, her friends knew that she was not a safe driver, but they were telling her, oh, yes, you're fine, keep driving. And that doesn't help anyone. So if someone's friends notice that someone is unsafe, it's important to let them know, to tell them. And certainly, your loved ones should be able to vent about their feelings about what's going to happen if they stop driving. And then you and your loved one can eventually brainstorm about how to compensate or find alternative modes of transportation when and if they do decide to stop driving. Another important component is to have professionals share their concerns. So someone's doctor can be a very important and an influential person in this difficult decision. If someone's doctor feels like their patient is unsafe to drive, there are a number of things that they can do. They can, first of all, give them some in-office cognitive testing, which gives some idea about someone's level of cognitive functioning. And if that functioning appears to be consistent with dementia, and they have concerns that this person isn't able to meet their activities in daily life, in other words, that their cognitive problems are affecting their life significantly, then they can take steps to help that person or actually get that person to reduce their driving or at least get a test to formally evaluate their safety. So doctors can write prescriptions for people not to drive, and this is not the kind of prescription where they'd go to the pharmacy and fill it, but we're talking about advice written down on paper, a prescription. They can also talk to the patient and be honest and give them a medical opinion of why they feel they're unsafe. And this is very helpful because it takes a lot of the personalized aspects out of it for the caregiver or the loved one. And finally, a doctor is mandated to, at least in the state of California, to make a report to the health department, who in turn notifies the DMV. And so I'm going to explain a little bit about that process. So if a doctor feels that somebody has dementia, and the dementia is serious enough to affect someone's driving, then the doctor can make a report to the health department, and in return, the DMV is notified. Now, in the state of California, what happens is the DMV will notify that person and send them a letter and ask them to come in for a driving test. So I want to be clear that a person does not get their license revoked on the spot. I think a lot of people fear that and believe that. Instead, they're asked to come in for a test. And then at that point, they'll take a written test. They may be asked to take a behind-the-wheel test. And their doctor will also continue to fill out another form. Once the DMV gets a sense of how this person is driving and if they're safe or unsafe, they'll still ask the doctor to weigh in. And eventually, a final decision is made as to whether a person drives or not. So this means that it is possible for someone with dementia to legally drive. If the DMV feels that they're not an imminent risk and their doctor agrees with this, then that person may continue to drive. In fact, a number of doctors have told me that even though they've made DMV reports, some of their patients still drive. So the idea here is not to rip somebody's license away, but to get a formal evaluation of their safety. And if they're not safe, then steps are taken at that point, and a decision is made about whether or not somebody should drive. But aside from that process, people can determine with their loved ones and by themselves if they feel comfortable driving and if they should drive. And so what we've been talking about so far is how to approach your loved one on this topic and to enlist the help of the doctor if needed or as needed. But mostly this is a collaborative approach. And the idea is to work on this in advance. Don't wait for something really bad to happen, right, like a tragedy. But if you see signs of poor driving, then it's time to address this. Most importantly, one has to create a new transportation plan. So you don't want to leave the person without any alternatives for getting around. This is what causes so much distress, and also it could be a health risk to the patient because they're not able to get needs met, like going to the doctor, for example. So this might require some creativity on the caregiver's part and on the patient's part. But talk about what the patient likes to do, what their daily activities are, and then look for ways to meet those needs. So this could be using family members to help the person get around, friends, community organizations. So maybe there's someone at someone's church or temple that would be happy to drive someone. There are also senior centers and adult daycare programs that might provide transportation or vans. There's also public transportation. That means potentially mass transit or community types of vans. In LA, we call it the Dash, for example. Or a program like Access, which somebody can call 24 hours in advance and arrange to have a van pick them up and take them where they need to go. And finally, there are options for private and for hire transportation. So it really depends on what people's finances are and how these transportation alternatives meet someone's needs. So for example, if you have a loved one with severe dementia, then that person should not be taking public transportation by themselves, right? So in those situations, you're looking at escorted transportation. So sit down, find out what somebody's daily routines and weekly routines include, and then try to develop a transportation plan around those needs. There are other resources that are available. I highly recommend the Alzheimer's Association. Their website has a lot of information about alternatives for driving, warning signs of driving. The Department of Motor Vehicles, I believe you can contact the ombudsman in your area who deals with these kinds of situations. Also, there are independent driving evaluations and tests, and there are different kinds. So, of course, one can always go to the DMV and ask for a driving evaluation, but there are also road tests from private organizations or other health care types of organizations. There are simulator tests, and people can even take online tests to get a sense of their driver safety. Now, I'm not going to advocate that one is better than the other, but if somebody in the privacy of their own home really needs to get an idea of their driver safety, for example, they might take an online self-test. Now, there are other ways to beef up one's driving skills, and so there are driver safety courses through AARP, for example. And finally, various insurance companies have put out pamphlets for how to know when someone is not a safe driver and how to approach this topic. So a number of the things that I talked about today can be found in a brochure called At the Crossroads, which is a Hartford insurance company, and also information from the Alzheimer's Association and other sources on the internet. So this concludes the lecture part of the talk, and now if people have tweeted in any questions, I'll answer those right now. Okay, thanks. Thank you for this handy tab. So one question is public transportation a good alternative to driving, or are there similar concerns? And the answer to that is, for some people, it is a good alternative as long as somebody is able to get on a bus, know where they're going, or a taxi, for example. But there would be concerns if a person has such severe dementia that they get lost, for example, or they have poor judgment. So it just depends on where your loved one is in the course of dementia. More, I would say, for moderate dementia and forward, it would not be a good alternative. When is driving with Alzheimer's disease or other dementias no longer safe? I think we talked about that. The important points are, is someone driving in such a way that they're either a risk to themselves, like getting lost in familiar areas. So unfamiliar areas, it doesn't matter. We all get lost in unfamiliar areas. Or if you go to a place 1 or 2 times a year and somebody gets lost, that's not a concern. But if someone, for example, has been going to the same grocery store for 15 years and they all of a sudden end up 5 miles away in another neighborhood because they got lost, that would be a big red flag. What is the role of the person with Alzheimer's disease in making the driving decision? That's a very good question. And we would hope that that person can help make that decision, that this is a collaborative process. But it's not always possible. And sometimes when somebody is very unsafe and they're at a risk for an accident or hurting another person or themselves, sometimes families have to take more drastic measures in stopping someone from driving. And these are called imposed driving cessation measures. And the Alzheimer's disease talks about some of these on the website. But things might be removing access to the car so that the car is no longer drivable, or the car is sold, or the car can stay on the premises, but a person just can't drive it. It's either disabled or they have a different set of keys or they don't have any access to keys. So these are more tough ways to approach this, but sometimes it's necessary. And what I'm really talking about is don't wait for a tragedy or an accident to happen. At that point, it's too late. Somebody's been hurt. There's been loss of property or property damage, and worst of all, loss of life. So if that happens, then you can figure the decision was made too late, right, to stop driving. We talked about the implications of mandatory reporting by physicians. So what that really means is that the person is going to get called in for a driving test. And then the determination at that point of whether the person should drive or not comes down to how they do on their test and what their doctor's opinion is. Aren't all old drivers somewhat less skilled, and why should people with dementia be treated differently? So yes, I mean, everybody loses some quote-unquote skill as they get older, right? And believe me, older is 40. We're not talking about 80. What happens is as we get older, yes, our reflexes are slower, for example. But having reduced skills can be bolstered or propped up through driver safety courses, for example. We're talking about people who have serious cognitive problems who cannot make decisions anymore and that in turn enables them to no longer drive safely. They're dangerous. But remember that other people also have driving restrictions put on them. So people who've had strokes, people with severe visual problems, people who have seizure disorders. So it's not just people with dementia. And the idea here is it's driver safety is the focus. Does that mean that everyone with dementia should turn in their keys? I think what it means is that if there are any concerns about somebody driving, they should get a formal evaluation. And that evaluation can help determine if that person is safe or not. And getting an outside opinion or an evaluation takes the burden off the family and the patient and gets some objective external information about whether they should be driving or not. Everyone has bad driving days. Should we keep track of exactly what the problems are? Yes, everybody does have bad driving days, but we're looking for a pattern of bad driving, not just a once-in-a-while thing. So even the DMV knows this, right? You can get in so many accidents, and eventually you get points against your driver's license, and eventually one can lose their license because they have too many accidents. So we're not just talking about a bad day, we're talking about a pattern of unsafe driving. But again, you need to ride with somebody and observe them in order to make these determinations. Are there any competency tests that tell whether a person is still able to drive safely? And that is yes, there are some resources in the community. You need to check in your own area to see where they are and who they are. You could also look at the Alzheimer's Association website. You can contact the DMV or look and contact ARP, perhaps, for driving classes. And we already talked about the DMV. What if the problem is not yet serious enough to warrant taking away driving privileges? Well, then we're really talking about what is that and how do you know it's not serious enough, right? So I think the important point here is to get an evaluation. But if someone is having some driving difficulties, people can make decisions to limit their driving, right? Don't drive at night. Only drive to certain locations. And a lot of people do this on their own. So that is really important and a great thing when somebody says, you know, I don't feel confident driving at night anymore, so I'm going to limit my driving to the day. Right, what if a person with dementia refuses to stop driving even after failing the driving test? So this is where some of those more harsh measures or more what we call imposed measures come in. That would be disabling the car, for example, removing the car from the premises, etc. And sometimes people have to do that. But the DMV is not going to come and arrest somebody if they continue to drive even though they have dementia. So it really does become what is the person actually doing once they lose their license. So someone said, can't we just hide the keys, sell the car, etc., or install a kill switch? And so the answer to that is yes, those are the imposed driver cessation, but that wouldn't be the first thing that you'd want to do unless there are some very dire circumstances that somebody, you know, is showing a lot of dangerous signs and refuses to stop, right? What you'd prefer to do to be more sensitive to the individual is to start those conversations and work on a collaborative plan. But again, if that is not working or hasn't worked, then and a driving evaluation, you know, isn't possible, then you might have to take those steps. Right, this is a great question. What about interfamily problems? Not all of us agree that driving is a problem right now. And this is a big issue, whether it's driving or does somebody need help at home, is interfamily problems. So the first thing is try to all get educated about dementia. That's number one. Because sometimes the family member who lives closest to the individual and sees all these things happening has a different impression than a family member that doesn't live with the individual or lives across the country. And maybe they talk to the person on the phone, but they have no idea how that person is driving, for example. So all the family member needs to get educated, number one, about what happens in dementia. Everybody should be reading some literature on that or going to the internet on that and looking at the warning signs of dangerous driving. If possible, people should ride with that loved one and see how that loved one is doing, see for themselves. And perhaps the best way to settle those types of issues is for the person to go get a driver evaluation at an organization. And then they can get some objective information from an independent source about how that person is driving. I think this is actually a great goal, no matter what, for everyone, is to get an objective, professional opinion on this so that somebody doesn't lose their license or is barred from driving prematurely or unnecessarily, and by the same token, somebody doesn't continue to drive when they're being at a high risk for an accident. So if that's at all possible, try to get that outside opinion, either one's doctor or a formal driving evaluation. And that was the last question. And so, give you that. So this video or this webinar will be available if people want to review it at a later time. So I want to thank you all for your attention today.